let's get started into part 2, because this is where you now, because everybody's coming up to me and going, well, how does it work? How does it work? That's what part 2 is all about. Okay. But I like the enthusiasm. Okay, so again, we're back to, I really want you to understand how the body works, okay? And your body, again, is a chemistry set, right? And it's always on, and it's always reacting. And some of the things that it has to do, right, is to keep your blood pressure from going too high, but at the same time, it has to keep your blood pressure from going too low, okay? Either side, you're out of balance, right? Okay? And this is going on all the time. There's a yin and yang all the time. This isn't like, oh, right now I'm going to have high and later I'm going to have low. No, there's a bunch of chemistry going on all the time trying to keep the tone of your arteries and your hydration such that you keep your blood pressure in certain normal ranges. Okay? And the same is true with blood sugar. Right? You want to maintain normal blood sugar readings. And we're going to talk about what normal is. Okay? And you also want to maintain balance between clotting and not clotting or thinning. Right? Okay? And you want to balance between inflammation and anti-inflammation. So everybody goes, oh, inflammation is bad. Well, what happens if you don't have inflammation? You get eaten alive. Right? All the bugs will kill you. Okay? So you have to maintain some inflammatory tone to keep yourself alive. So do you see what's happening? We're getting into these terminologies where we think all these things are bad. Okay? And yet they're normal physiologic processes that actually keep you alive, okay, and healthy. Okay? And what about the balance between building and using, or using and building? That's what we've been talking about, right? So all of this is what I'm going to term homeostasis, and your body's in charge of doing this autonomically with or without you, okay? Or despite you, I should say, okay? Because what happens if you don't eat, and I'm going to keep using like not eating carbs or fasting as my example, because I used to do it the other way around. I used to say, what happens if you eat too many carbs? But very few people are doing that these days. Okay, so when I first started writing books, it was all about people eating too many carbs. Now I'm having to write books about people eating too few carbs. You guys are going to keep me in business forever, right? And by the way, I hate writing, so you're not helping me. It's not my favorite thing to do. But I keep doing it because I keep saying, we got to get the information out there. You know, this is awful. But anyway, what happens then biochemically if you, let's say, you eat dinner at 7 o'clock, okay? And it's a balanced meal, or not. And you're supposed to promote glycogen stores, right? You guys know what glycogen is? It's the storage form of sugar, okay? And mostly it's the storage form of sugar in your liver, which is what you can access in between meals to keep your blood sugar steady, okay? So basically when you go to sleep then, are you eating? Usually not. Nobody's like sleep eating, okay? So you are fasting right away, right? And as you're fasting, you still need glucose, right? So where's it going to come from? It's going to come from the glycogen releasing the cortisol, the glycogen releasing the sugar, okay? That then is going to feed your brain. Do you have unending supplies of glycogen? No, okay? And depending on how you ate that day, okay, depends on how much glycogen you have. You can deplete your glycogen stores. Okay? If you don't eat enough complex carbohydrates throughout the day, over time you will have very little glycogen in your liver, and you will be more prone to hypoglycemia in the middle of the night. And that's one of the things that can wake you up, okay, and not let you sleep. Now again, it doesn't happen the first time you do that or the second time you do that. You know, so by the time you've been doing something for a couple of years and all of a sudden you're starting to wake up in the middle of the night not understanding why you are, you're not going to go, oh, that's right, because 2 years ago I started depleting my glycogen stores, right? It's not that easy to think about. But there's only a few things that can happen. Oh, and if you drink wine when you do that, right, what does wine do? It blocks you being able to access your glycogen stores. So that's how one of the ways that alcohol disrupts your sleep in the middle of the night. Okay? So you start to add all these little things together, and again, you're adding all your habits up. Okay? But anyway, I went to sleep, and I didn't eat enough complex carbs, and then I depleted my glycogen stores. Okay? Am I going to die? No, my body is going to keep me alive. How is it going to do that? It's going to raise hormones that are going to cause me to start making sugar. Okay. Do I make sugar from fat? Not really. So unfortunately, right? Because we'd love that. Okay. If that happened, we would have a whole different conversation today. Okay. But you're making the sugar from your amino acids. Okay. Oh is right. Okay. Yeah. Oh, wait. I don't know where the... We have a question.
Thank you.
Why are you saying that we don't tap into our fat stores?
Oh, I'm not saying that you don't tap into your fat stores, but it's not the first thing that you do right away. You can't just go from sugar to fat. That takes a while to get into fat stores. Usually 72 hours, somewhere in there. But again, and we're going to get into, let's say that we are tapping into our fat stores, okay? That means I'm breaking down my fat. It also means I'm not rebuilding my proteins or my complex carbs. So I'm still in using mode. So whether or not that physiology occurs, it's not the physiology that we want. Okay? It's not about how fat am I. It's about which hormones am I asking my body to turn on in order to compensate for what I'm doing. And if I have to go into my fat reserves, that means insulin has gone down, and adrenaline and cortisol and noradrenaline has gone up, and it means I'm in the using side of my physiology, which is not where I want to live. That's for emergencies, which we're going to get into when we talk about the stress system of the body. Yes?
Just a quick question, because I know you have a lot to cover. Are you saying ketosis, don't go into ketosis?
I'm absolutely saying don't go into ketosis.
Thank you.
You're welcome.
There's so many people that are promoting that.
Yeah.
That don't realize that that is not a good thing.
Yeah, we do not want to go into ketosis. That's really about breaking down, right? To get into in fact, what is diabetic ketoacidosis? Okay, it's not having enough insulin to keep yourself from ketosis. That's the extreme because there's no insulin there, right? So the type 1 diabetics can get very ill and die from that. But you can do that on your own, by doing extreme diets. Okay, again, not the physiology you want to live in. You guys, you know what? I'm going to ask you to hold questions until I get to some physiology, or else we're never going to. You're going to be here till midnight, and then I'm going to be feeling bad that you didn't sleep. Okay, then we'll all sleep here. Okay, but because really I have a lot to cover, so I'm going to hope that I'm going to answer a lot of your questions as we go along, and then at the end we'll get into that. Okay, otherwise I'll never get to what I need to say, and then you're going to be left going, but you never told us what to do. Okay. And then it'll be your fault. No, I'm just kidding. Okay, so then I'm going to wake up in the morning, and I'm going to fast. Okay, I'm not going to eat breakfast because I don't. Okay, so now I'm going to have a cup of tea or a cup of coffee because I need that caffeine to get going. What does caffeine do? It raises adrenaline effect. What's adrenaline? It's a using hormone. Okay. What does adrenaline do? It promotes gluconeogenesis. So now you're going to start breaking down your proteins into amino acids to turn them into sugar to feed the brain. Okay? And again, yes, at some point you'll go into using fats for the same reason, but now you're in breakdown physiology. So if I live in breakdown, I can't be living in building. So over time, sure, I can feel good, I can be alive, but I'm going to get diseases over time. And that is the key. I really wish the moment you did this, you keeled over. Okay? I really wish your body would tell you you're doing something wrong, because then you would never do it again, would you? Okay? No, but it doesn't tell you that. It actually feels good. I feel high. That's a great high. Breaking down feels good. Okay? So again, when I'm breaking down, blues are bluer. I have more energy. I feel more focused, right? Why do people smoke? The nicotine focuses them, right? Calms them down. What a great feeling. Well, I have this focused energy and I can do what I need to be doing, right? Until they break down so much the nicotine doesn't work anymore on their chemistry, right? My favorite is when I get patients to stop smoking and they gain a lot of weight, right? Because the nicotine is also on the using side of the metabolism, but they've broken down their whole metabolism. At the moment they start eating normally, they gain a lot of weight, right? Everything has consequences. You can't be in using mode, and the moment you stop and start to build, you're going to gain weight. That's what happens. Okay? Of course, what does everybody start thinking? I should have never stopped smoking. Made me gain weight. Okay? I've seen smokers get asthma from stopping smoking. Right? Because nicotine is like adrenaline. Okay? And so what do we use to treat asthma? Adrenaline-like drugs, right? Cortisol-like drugs, because they keep the airways open, right? Just like what happens in sympathetic drive. So the next thing you know, they're all vasoconstricted and their smooth muscles constricted and they can't breathe and they go, oh my God, you know, stopping smoking caused asthma. I'm going to go back to smoking. Okay? Have you guys, anybody stopped smoking and noticed any bad effect from that? Like, wait, I mean, anybody smoked? Maybe not. But anyway, this was for me 25 years ago, 20 years ago when I first started seeing this, and I was like perplexed. You know, really? You're going to stop smoking and fall apart? You know, what is going on? But at least I knew enough to say, no, it wasn't that you shouldn't have stopped smoking. You should have never started smoking to begin with, because that's what damaged your metabolism. But anyway, so now I'm in my using side, and again, I'm going to continue to use because I can move, I can breathe, I'm functioning, right? And then little things start to happen. I start to get maybe a little skin rash, maybe heartburn. Heartburn is the using side of the metabolism. I start to get a little bit of insomnia. Sometimes I get headaches because basically migraine headaches, what are they? They're when your blood vessels relax from being constricted, right? It's actually the relaxation and all the blood that flows in with all the histamines and all the cytokines that come in that causes the headache. So why do people then go to caffeine? Okay, to vasoconstrict, right? The treatment of migraines is vasoconstriction. But again, it's this over vasoconstriction that then you eat and it relaxes everything, because if you're eating carbohydrates and proteins together, you're going to increase insulin. And is insulin a vasoconstrictor or a vasodilator? It is thank you. It's a dilator, okay? Everybody thinks it's a constrictor. It increases nitric oxide release, which is a very potent vasodilator. It's the most important vasodilator we have. In a minute, you're going to see the biochemistry behind that. Okay, so that's, again, when you start to see how we're putting the pieces together with biochemistry and what's going on in the body. Okay, so back to, we want balance, right? And these are things that we're going to try to keep balanced until we no longer can. Okay, and then we end up with disease. Okay, but isn't it interesting to note that all degenerative diseases of aging have these types of physiology in common? Higher blood sugars, more clotting, they're going to have higher blood pressure, and increased inflammation and oxidation. Why do you think that's true? It's true because there is no such thing as chronic hypoglycemia. You know what that's called? Death. Okay, there's no disease. Okay, so your body is saying, wow, okay, I've got two sides to metabolism and I'm doing all the wrong things and I want to stay alive. I'm going to break down to what keeps me alive. Okay, and this is what I introduced earlier, saying chronic disease is your body way of keeping you going, right? Okay, is that making sense? You guys follow me on that? Okay, so you don't, the lesser of two evils, you do not survive with low blood sugars. Why do you think there's 5 hormones against insulin that raise your blood sugars? 3 are major, but the other 2, glucagon and growth hormone, counter insulin as well. Okay, so you've got 5 to 1, and even at that point, if you're getting hypoglycemic, your body's going to lower insulin even further to try to get you to become hyperglycemic. Okay, you know what I'm seeing now in my office? Patients on low-carb diets coming in with diabetes who've never had diabetes before. Why is that? Because they're lowering their insulin and they're raising their adrenaline and cortisol and noradrenaline. And that drives gluconeogenesis and they start to become hyperglycemic. Okay, you know why we know that? Because we get them to eat carbs again and we reverse the process. Okay, so if you don't, you know, so again, makes sense, but again, you're going to hear some science, okay? And then you're going to know as well. So you don't survive with low blood sugar. You also don't survive with very low blood pressure, right? You can survive longer with high blood pressure. No one's saying, oh, yay for high blood pressure. You know, we're not saying, yay, I hope you get high blood pressure, okay? But I want you to be alive, right? So yay if you get high blood pressure. But if you do, you got to go, what have I been doing? Okay, what caused my physiology to do this? Okay. The same thing goes with clotting, over clotting, okay? All these diseases have in common, if you look at them, okay, that there's more clotting involved. And the same thing with inflammation. Isn't that the big catch term right now, inflammation? Where do you think inflammation comes from? It comes from your sympathetic nervous system turning on your immune system, because that's the fight or flight response, right? So you are pushing your chemistry. All autoimmune disease lives in the using side of your metabolism. Right? Because on the other hand, there is no disease because you can't survive on the other side of that. See what I'm saying? Okay? That's why our diseases have these problems. Okay? Because everything you can end up with a disease on the other side. That's called death. Okay? But you can't live long enough for me to do anything about that, right? Or for your body to do things. So you really do want your body to push you towards all of these imbalances on this side if you're doing it wrong. But we're not going to do it wrong anymore, right? We're going to learn how to do it correctly. Okay, so again, if I haven't driven it home yet, chronic disease is your body's way of keeping you alive. And I make all my patients hug themselves when they come in for the first time, because they wouldn't have been able to walk in if their body let them succumb to their habits. And just to remind you, we're talking about heart attacks and strokes and Alzheimer's dementia, cancer, diabetes, and osteoporosis. What do they have in common? Oxidation, inflammation, clotting, glycation, hyperglycation, right? Okay, and a little bit of hypertensive along with that. All right, so we used to live to around, again, if we're going to talk about longevity, to about 50 in the wild, okay? We didn't live to 100. We didn't live that long. And yes, did some people live that long? Sure they did, okay? But we're talking about collectively, right? Okay, because we would die of infectious diseases, or we couldn't run as fast, or there was a predator. All I had to do was outrun you, not the predator, right? To keep me alive. So when I start to get into my, late 20s or early 30s or 40s or somewhere in there, especially when there's not a lot of food around, I'm not going to be as strong as someone younger than me, right? So again, I'm going to succumb to that kind of stuff, all right? Lovely. This is why we're all here today, because our ancestors survived to procreate. Thank you very much. Okay. But now we're saying, hey, what about the next 50 years? If your goal is to live for 50 years, do whatever you want to do. You will get there. It's a free-for-all at that point in time. Do whatever you want to do. But if you want to be healthy living longer, you've got to honor physiology and biochemistry, okay? And you really have to stop wanting to just lose weight. Losing weight is not how you stay healthy. Being healthy is how you lose weight, okay? Being in balance. So, it's the stress system, okay? Let's talk about the stress system. Let's get into that. There are two components to the stress system. One's hormonal, pure hormonal, and the other is neurological, okay? And just to make this clear, when I say stress system, I am talking about the using side of your metabolism. Anytime you tap into your stress system, you are using, okay? All right, so on the hormone side, and I'm sure you guys have heard all of the hormones, hypothalamic, pituitary, adrenal axis, right? Okay, so we have the hypothalamus sending a hormone to the pituitary, sending a hormone to the adrenal gland, and the end result is the release of cortisol, a using hormone. Okay? The only time cortisol might be considered a building hormone is if you have cortisol with higher amounts of insulin. Then you build a lot of fat. But if you have high cortisol and low insulin, you actually lose a lot of weight. It is a muscle wasting hormone. Okay, so in order to store fat, you actually need insulin along with cortisol for that to happen. And then if you have that, you will gain more fat than just insulin alone. Okay? But again, people always say, oh, but cortisol, I thought it made me fat. Not in a vacuum, not in a vacuum, okay? So start to learn the differences between what happens with, if I'm going to isolate a hormone, which of course I can do that to look at it, but that's not how the body works, right? So then I have to start throwing other hormones in there, right? Have you ever heard, like my patients come in all the time, well, why if I do this happens to me, but I know many people who do that and it doesn't happen to them, right? Okay, well, what else is going on in the body? Because all of us have different biochemistry sets, Okay? And it starts from the moment you're in utero and conceived, right? And all the changes that have been going on throughout your whole life. Every one of us is different. Okay? And it has a lot to do with epigenomics, which you were talking about. Okay? Identical twins do not get identical diseases. Okay? They age differently. Things will happen to them that's different. And it has to do with the proteins that are surrounding their genes, which either activate or deactivate the gene at any given moment. Okay? That's epigenomics. And then, of course, those proteins are being shown to be regulated by, anybody want to guess? Your habits, right? What hormones are being triggered to tell your body what proteins to have surrounding, to tell your body what genes to activate or not. Here's my favorite when they were doing the genome project, and they thought, what did they think? Oh, we're going to know all about disease when we figure out all the genetics, right? Only to find out that everybody had a gene for heart disease, and everybody had a gene for cancer, and everybody had a gene for Alzheimer's dementia, right? That was like the biggest surprise of all. But this is why, because it's not about what your genes are, it's how you're activating them, okay? Okay, the sympathetic nervous system. So the other component is of the stress system is the sympathetic nervous system. What's the other name for the sympathetic nervous system? The fight and flight response, okay? But we're beginning to understand a lot more about this, because it used to be, oh my God, only when I'm in really dire straits is that system going to turn on, and that's not true, okay? You can turn this, in fact, you turn it on every day you get out of bed, okay? So in order for you to engage your muscles and get your blood pressure to go up when you stand up, right, you're engaging in this side of your body in order to be able to do all that, right? Because if you don't have adrenaline going up, which is this side of the system, you're not going to vasoconstrict, right? Your muscles are not going to contract, right? So again, it's all about physiology. And obviously there's degrees, right? Okay, so what I'm trying to say is there's nothing wrong with this system. We're not trying to eliminate it, right? So now when we talk about all the bad things it can do, it's not like, yay, let's get rid of our sympathetic nervous system. Because if you do that, you're dead as well. Okay, so again, it's all about balance, isn't it? Okay, what's the catchphrase in endocrinology? Balance, okay? So basically, the cortex and the amygdala and the hypothalamus, right, they're all connecting, and it depends on what's going on. And then you start to send stress signals, and again, I'm going to call them stress signals because these are the signals that turn on the stress system, right? It doesn't have to be like, again, my house is on fire or anything terrible is happening. I'm engaged when this goes on, okay? So, and you'll see in a minute, because we're going to look at that. But anyway, so what happens then? The signals are leaving the brain, they're going through nerves, they're going through the midbrain down to the spinal cord. And where are the nerves of the sympathetic nervous system located? The beginning nerves are in the thoracic to lumbar spine. Okay? And then you're going to see that all these nerves shoot out from those areas to every organ and every gland of your body. No one is spared. Okay? And that's what it looks like. Am I in the way? Oops. That is not what I'm trying to do. So let's try that again. Okay. So here's what we're saying. Okay, see this? See all these nerves? Look what they're doing. They're going everywhere, aren't they? What is what now? Oh, this is the sympathetic nervous chain in your spinal cord. This is where your nerves begin for this response, okay? So they're all the way through here, and they start to leave, right? Look, they leave at different levels. Oh gosh, I keep hitting the wrong button. See here, right? These are the beginning of the nerves, and then they're leaving, and they're going to ganglion. That's the first thing that they do, and then they split off, and they go like to your blood vessels. They go to the thyroid gland. They go to your lungs, they go to your heart, okay? All your organs are innervated by nerves. Did you know that? Okay, people just think it's about, feeling and contraction, but every single one of your organs is being talked to at all times by nerves. Okay, that's what I'm called neuroendocrine. What is the end, in most cases, the chemical that's secreted at the end organ, what do you think that's called? Noradrenaline. okay? It's known as a neurotransmitter, okay? That's the chemical that's released, okay? And it does the same thing as, look at this. Where's the adrenal gland? Right there. Oh, look at this. There is a nerve directly from the sympathetic nervous system to the medulla of the adrenal gland. What hormone is made in the medulla of the adrenal gland? Adrenaline, thank you. Okay. Cortisol is made in the cortex. Okay. But adrenaline, so look at that. My sympathetic, once I activate this chain, I am releasing adrenaline. What does adrenaline do? It does exactly what noradrenaline does, right? It goes back to every single one of your organs and glands and propagates that signal. Okay? Now, that's not a bad thing, right? It's an is thing. This is keeping you alive, right? You want this to happen. But what if this were the only thing going on? Is that what I want? Do I want to keep using and using and using and using? No, okay? You can see how that would wear you out, right? Because there's no rebuilding and functioning again, okay? So the other part of the autonomic nervous system is parasympathetic. But this basically, you know what's happening is, that's another yin and a yang, okay? So you've got all these different yin and yang things going on, okay? You're supposed to be able to flip back and forth between these two systems. But what happens is people get into habits that turn this on, and then guess what? You get stuck there, okay? Post-traumatic stress is getting stuck in there, and that's obviously an exaggeration of that, okay? But people with anxiety disorders, doesn't have to be post-traumatic stress. People with insomnia are stuck in there. People with tachycardia, autoimmune disorders. Okay. Now, the other part of that, which is really important, is the cortisol part. So, adrenaline and noradrenaline are inflammatory hormones. When they go up, you release inflammatory chemicals. What's your anti-inflammatory hormone? Anybody know? How about if I said glucocorticoid? Cortisol, you're right. Right? Cortisol, right? What do we give to people? We give high-dose steroids, right? When they're inflamed, okay? But in our body, the anti-inflammatory hormone, the big one, is cortisol, okay? Well, of course, I want to trigger inflammation, but I got to put out the fire, right? So if I don't do both at the same time, I'm in trouble. See how your body's trying to protect you, right? So it's really important in times of stress because, again, you're going to activate the immune system. So all of this is happening at the same time. You're not going to say, oh, well, I didn't want my immune system to activate. I just wanted my heart rate to go up, okay? No, it's all going to happen at the same time when this happens. Anytime you enter into right now, what do you think is my heart rate lower or higher? Yeah. What about my breathing? It's faster. My blood pressure? Higher, okay? Am I hypertensive? No. Am I tachycardic? No. Do I have asthma? No, okay? But certainly not relaxed and parasympathetic, right? So this is what I'm talking about, okay? So if you look at my pupils, they're probably dilated. You think I'm high. No, I'm just kidding. Which I might be. No, I'm kidding. That's me trying to be cool because I don't do any drugs. But you see what I'm saying there? Okay, again, just the activity puts you in this mode. So how long do you think I could just stand here and talk to you? And talk and talk and talk. Longer than probably Jonathan would like. But, okay. But in general, if I just kept doing that, right, I'd wear myself out. I can't do that, okay? That's why it's time to stop and relax and go to sleep and start the day again, okay? And it's really important to even be able to do that in between, right? Okay. You know, I've given lectures where I've lectured all day long. Believe me, by the end of it, I thought, oh my God, I just aged myself, okay? Just by talking, okay? Because you're spending a lot of energy doing that, okay? All right, stand up, everybody. Well, remember, just you could ask them, hey, can we stand up every? All right. Now we're all into sympathetic. No, I'm just kidding. Yes, I saw that. Okay. All right, we're running out of time, and I'm really not getting where I want to go, but at least we're going to get to the science of it all. Okay, everybody understand the using side and what's going to happen? It's going to happen every time. So every time you skip a meal, you go into sympathetic. Okay? This is the system that raises your blood sugars. Okay? This is the system that when you do raise your blood sugars, you're going to have your blood pressure a little higher, right? You're going to have your heart rate a little higher. Okay, again, is it going to be like, oh, I went to the doctors and they said I had tachycardia and hypertension? No, it's just going to be higher. Okay, and that's wearing the system out. We don't want to live here. But do we want to be here sometimes? Yeah, because guess what? Breaking down begets building, doesn't it? Okay, so when I put a stress on my system and then I eat correctly and sleep, that stimulates rebuilding, and that's a good thing. Okay, here's the bad news though. That happens until about the age of 35 for women and maybe 40 for men. And after that, it's all aging, okay? Because what happens to us as we age? We lose the ability to rebuild as well. We can still build, just not as well. So we have to stop breaking down at the same rate, right? You got to start thinking about that, okay? And guess what? Can I do it for you? No, okay? It's your day-to-day habits that determine whether you're breaking down or using or building, right? All right. Here's your magic pill. That'll be $1 million, please. It's not going to happen. Okay, and just again, just to say, again, we're going to have, the sympathetic, every time it turns on, dilated pupils a little bit, inhibits salivation. You know how dry my mouth is right now? Okay. Probably you don't know, but it is. You're going to get bronchial dilation. This is why we use adrenaline-like drugs, okay, to treat asthma, okay, because they mimic adrenaline, okay, which is doing that. You're going to have inhibits digestion, right? This is not the time. Oh yeah, in the wild, something's after me. Hey, let's have sex, okay? Let's eat a meal, okay? Because also over here, okay, your sex drive is going to go down. I can't tell you how many people come in thinking that their sex drive is low because of low testosterone, and it's not. It's because they're living in sympathetic and they're turning off their sex drive, because you're not going to go, what a great time to make a baby when it's stressful or something's after me, right? Not going to happen. Okay, moving on. Okay, so now I want you to have a different definition of stress. It's not about emotional anymore, okay? It's whatever you're doing that engages your stress system, right? That's a hormonal definition. If you are doing something that raises adrenaline, cortisol, or noradrenaline, you are stressed, okay? Do I want to take all that away? No. Do I want you to be there all the time? No, right? There's a balance going on and we need to find it. All right, this is really what I wanted to talk to you about. This is my favorite slide, okay? It's called biochemistry. Isn't that exciting? I'm not going to bore you with all the things, but here's one thing I really want you to know. Ooh, 2007. That's not very long ago, is it? Okay. What is this telling us? We now know when insulin binds to its receptors, what is going on that changes glucose metabolism, that increases nitric oxide formation, which increases endothelial 1, which promotes gene transcription, protein synthesis, cell growth, and differentiation. Isn't that exciting? It is. 2007. Okay? I lived long enough to know how it works inside the cells. That's really exciting for an endocrinologist. I hope you share it. No, just kidding. This is a big moment. Okay, but here's what I really want you to understand, okay? See everything up here? This is your bloodstream. When I draw blood on you, or anybody draws blood on you, what am I looking at? Am I looking intracellularly? No, I can't see inside your cell, okay? All I can see is out here. And before 2007, we had no idea. We had no idea what was going on. We knew insulin had something to do with blood sugar, right? We could see that. We just didn't know what it did, okay? So we're putting all the biochemical pathways together. That makes it very easy to tell a diabetic what to do. And I know you're not going to be surprised when I say this, but we've been telling them to do the wrong thing, okay? Because if I think that diabetes is all about blood sugar and insulin, right? What do I normally see in a type 2 early on? We will see higher blood sugars, right? And higher fasting insulin levels, hyperinsulinemia, right? And then we say, oh my goodness, high insulin is bad, right? Just as much as high blood sugar is bad. So what do we always try to do with patients with diabetes? Lower their blood sugar, okay? Well, guess what? And I'll get back to this slide. This is what we now know of insulin resistance, okay? The PI3K pathway is damaged, okay? So let's go back. Look at this. Oh, I keep hitting the wrong thing. Look at this, all right? This is the PI3K pathway. And look at this, it branches off into glucose uptake. It stops gluconeogenesis, right? You're going to bring sugar into the cell, you're not going to make sugar, right? You're going to stop it. And it's going to increase glycogen synthesis, right? All that makes sense. That's what insulin does, okay? But at the same time, nitric oxide is going up. Everybody know about nitric oxide, the most important chemical your arteries make to keep you from having heart disease and strokes? Okay? So, guess what hormone stimulates the release of nitric oxide? Insulin, okay? Now, what if this P13K pathway isn't functioning? What am I going to start to see? I'm going to start to see blood sugars going a little higher, okay? I'm not going to see nitric oxide going lower because that's not something I can measure in the blood. Okay, so if I don't know that's happening, I don't know that's happening, right? We have not linked low nitric oxide with blood sugars before, okay? Isn't that kind of remarkable? Okay, this explains why now all of those studies that were done on type 2 diabetics, getting them to lower their blood sugar by decreasing caloric intake, decreasing carbs, and increasing exercise, caused them to die more of cardiovascular disease. Okay. Now, what pisses me off, 2007, the science was known. We did another one of those wonderful studies a few years later, and the same result. You want to hear what the endocrinologist leading the study said? The study was stopped today because we saw more death in the treatment group. However, we don't believe it. Now I'm going, when are they going to believe it? Because I have the science that would tell you, of course that would happen. Okay? You drive the sugar down, what is that going to do to insulin? No. Down. It's going to drive it down, which is also going to then mean nitric oxide is going to go down. Okay? What is a trigger for insulin release? Sugar. Okay? So the blood sugar is going down, my insulin is going down. Okay? So really, hyperinsulinemia is the compensatory mechanism to having damage in this system. That's damaged. Okay? That's what insulin resistance is about. I do not want to take somebody who can't make nitric oxide and make them make less nitric oxide just to lower their blood sugar. Okay? You following me on that? Scary, isn't it? Okay? This is why it's my favorite side. It explains what we've been seeing all these years and why it's been such a mystery. Okay? And I will tell you that, yes, someone asked me earlier, we saw like early work from you saying, higher protein diets. And I said, absolutely. And within 2 years, I was watching my patients fall apart. And I said, oh my God, what are we doing? And revisited the whole thing. That was 25 years ago, or 23 years ago. Okay? So it's one of those things where you have to always kind of go, we didn't have the science back then, and we just thought that sugar was the enemy. And if we could lower the sugar and lower the insulin, that everything was going well. And then that would look great. I have to tell you how great my patients looked for 2 years before they fell apart. They looked fabulous. I've never seen anybody look healthier. Okay? And then they fell apart, and I went, what? What happened? Okay? And then I went, could have had a V8. Okay? Because I started looking at the other side of the metabolism. I wasn't looking at that. I wasn't trained to look at both sides. I was trained to treat diabetes as an isolated issue. Okay, without thinking about the physiology of it. Okay, I hope this is not confusing you, because again, this is really the reason you don't want to eliminate carbohydrates. Okay, yeah.
Couldn't there be effective cycling?
Oh, hold on.
couldn't there be effective cycling instead of reaching an equilibrium that you have to maintain?
Okay, so
throughout?
explain that to me since I'm not really sure what you're saying.
Got it. So if that's the case and they did it for 2 years, couldn't they go on a much shorter cycle? So instead of having regular carbs all the time, taking it out and then feeding it back into the system to make sure that all of their levels aren't depleted and they continue to produce nitric oxide continuously?
Well, again, the problem is the moment you take that's fine for someone who's not damaged, but then I think it's going to cause damage. But you cannot take somebody who has a physiology of not making nitric oxide and remove carbs at that moment for how long you want to do that and expect them to make nitric oxide. They're already deficient in nitric oxide. At any moment, at any given time, you do not want to lower it more. So I think where the problem arises in some of these studies or people trying to look at things is that they're taking healthy individuals and doing that with them, or more healthy. They're not doing this in diabetics, okay? The moment you take a diabetic, and this is how I learned the science of diabetes, because I was treating them as though they had normal physiology, okay? And the moment I started to do that, we started to push on their system. And initially that looked great, right? I'm getting them to break down even more. I'm watching their blood sugar go down, and that's making me happy. It no longer makes me happy to do that because I know that I'm increasing their risk for coronary artery disease if I'm pushing to do that, okay? If I'm getting them to eat well and I'm activating their insulin and it's insulin that's pushing that sugar in the cell, then I know it's linked to nitric oxide and I'm helping them, okay? But no, I think that's where the problem arises. Like a lot of physiology studies are done on healthy individuals, okay? And I'm not talking about healthy. And I'm also going to tell you that if you then take a healthy person and you do that long term with them, you will create disease in them. That is my opinion from physiology. But I absolutely know you can't do it to somebody with type 2 diabetes. And I know you can't do it to somebody with insulin resistance because it propels them into further insulin resistance and diabetes. Okay. And my work initially was about that. When patients would come in to see me, I would listen to their story, and they'd always like, well, when I first was diagnosed, my blood sugars were a little bit high, right? It was incidental on a blood test. And then I went on the diets and the exercise and the meds, and now all of a sudden, their diabetes is so much worse. And yes, you could argue, well, it's a progressive disease, but I'm going to argue it's a progressive disease because we treat it incorrectly, and we're pushing on the chemistry to actually make this worse. Okay. Now, I know this is a big leap because it's the first time you're looking at this science, but I've been looking at this for 25 years. Okay. And I have been treating patients with diabetes for 25 years. And the only way I've ever seen it start to reverse itself or, not cause coronary disease, because we do a lot of, testing in my patients for heart disease, okay, is when we are not trying to fix something overnight that cannot be fixed overnight. And I think that's the other side of this. Now, I'm giving you an extreme because we're not just talking about type 2 diabetes with everybody, but you extrapolate to the extreme so you can bring it back to the mainstream, okay? And then talk about physiology in general. And like I said, right now, what am I seeing? I'm not seeing a lot of primary insulin resistance. I mean, yes, there's a lot of type 2 diabetics. That's what I'm going to call primary insulin resistance. Here's what I'm seeing. I'm seeing people lowering their insulin levels and blocking both sides of their chain, right? And of course I'm going to see high blood sugar when that goes up, right? So we're starting to see high blood sugar. How do we know they're not insulin resistant? Because we're not seeing the classic cholesterol profiles that go along with that. So that's number one. And then number two, when I get them to stop doing that, it all reverses right away. Okay, that's a secondary change. Does that kind of make sense? Yes, yes. Low carb diet with stress, with overexercise, everything that pushes on adrenaline, cortisol, and noradrenaline. I was like, where is he going?
No, what about a cyclic ketogenic diet? It's not something that you recommend for I guess for a healthy person?
I'll tell you what, I'm not quite sure what you're trying to accomplish with that. So if you can tell me that, I'll answer it. I mean, what's the idea behind that?
In my case, I'm just trying to reduce body fat in the short term, and from a long term health and longevity and
Right.
anti-aging perspective.
Right. So
I
what
thought that's how evolution we have lived.
to age 50?
Uh,
Yeah. I'm being serious because
I don't know.
you can push on the using side, okay? And it will compensate for you, but it won't do that forever, okay? And you know this from people who do cycling low-calorie diets throughout their whole life, and all of a sudden one day they go, I can eat nothing and I'm gaining weight, okay?
No,
I see
I mean-
that all the time.
I mean, when you say low carb, you have to define what is. I'm trying to find out what
No,
is
low
optimal.
calorie is what I said. Low calorie.
not-
I'm just saying you can take the same physiology, right? Because all I'm saying is when you do that, what
Right.
hormones are in play? Okay, here's what adrenaline does. Here's what cortisol does. Here's what noradrenaline does, and it will do it every single time you have that habit. That's what's immutable. See, that's what people are understanding. Okay, I'm not coming up with the science. The science is there. So anytime you put yourself in breakdown mode, you are turning on the sympathetic nervous system to break down. Now again, when you're younger, you see it in athletes, right? That type of stress gets them to rebuild better. Okay? But they're younger. Okay? They have the capacity to do that. What happens to all of us as we age? We lose that ability. So now the same amount of stress does not cause the same amount of rebuilding. That's what everybody's forgetting about. It isn't about what you can do when you're 20 or 25 or 30 or what you're going to feel. It's really what's going to catch up to you if you continue to do that over a long period of time. Okay? And the same thing goes, just take alcohol. Okay? The moment you drink alcohol when you're a kid, you metabolize it really fast, right? And you just, oh, it didn't hardly affect me. Okay? Now people go, oh my God, I drank half a glass of wine and I'm looped. Okay? And you'll see that as people are getting older, you don't handle things like you used to handle. Okay? So I'm not here to try to convince everybody to do it exactly the way that I do it, but I want you to start thinking about when you're doing something, what are you doing and are you balancing out? Okay, because no, I haven't been able to study every permutation on the planet to know how that works. But I can tell you from my patient population, anytime anybody's been fasting or hasn't been eating breakfast or has been doing weird diets, I have never seen anybody come to me doing that and being healthy.
The reason I was asking was, I mean, actually, to be honest, I got started with this when I first read your book. I didn't complete the book. You know,
You didn't finish my book?
No, I've never completed any book.
I'm not talking to you.
But you told me to eat a lot of eggs, and I still eat a lot of eggs today.
Now, see, now
Eggs
that
and
was the,
butter and,
yes, I was saying, and you can still do that, but you have to balance that with carbs. And what I'm trying to say is you are the reason I wrote my second book, okay? Because unless you were a diabetic at that time,
Right.
you shouldn't have been following that program. That's for an insulin-resistant person, and in that book it talked about you had to have more complex carbs if you weren't insulin resistant. Of course, everybody thought that they were if they had a little fat on them,
Okay.
right? And they misdiagnosed themselves, and that's what made me write the transition book, which talks about the adrenaline and the cortisol
No, I
system,
haven't read
and
that.
don't fall into the trap of doing that.
Okay.
Okay, and what's making me write my next book is actually the science that came out since I've written my books, to really go, all right, this is what I've seen, but guess what now? Now I can explain it to you, okay? Yeah.
I was wondering about, what you hear about a lot about coconut preventing Alzheimer's from developing, and in order for the brain to benefit from it, you need to go on this ketogenic diet and stop all your carbs. So, and then you have that benefit for the brain if you eat a lot of MCT oils and coconut oil. So, what about that?
Well, I think I like coconut oil, but I don't think you should go low carb for that, okay? And I'm going to say that we now know that insulin plays a huge role in brain function. We never used to know that it crossed the blood-brain barrier or did anything. And now we know insulin plays a huge role inside your brain for memory. They are calling Alzheimer's dementia type 3 diabetes.
Yeah, I heard about
It's an insulin-resistant condition. So no, you eat that way. I'm going to tell you that's going to increase insulin resistance. But initially, right, you're going to feel more focused and you're going to see improvement. But I don't think those studies that you're talking about have been long-term. Okay, so my problem is you can do a lot of short-term studies and see a lot of chemistry change that looks better. I did it with my patients, so I know that. Okay, but if you follow long-term, you start to get chinks in the physiology that you have to start rethinking the whole thing. Okay, and by the way, you know that they've talked about the same thing, ketogenic diet for kids with seizures. they're now saying long-term doing that is very damaging to the same kids. So it works in the short term, not in the long term, which again makes sense. Okay.
So if you do include, you know, the complex carbs, then and you do eat the coconut oil also, will the coconut oil help your brain?
Sure. Well, you know what? Your brain loves
Alzheimer's?
saturated fat. It needs
Yeah.
healthy saturated fat to survive. Absolutely. That's one of the most important things you can feed your brain. Yeah. So it's for me, it's all about balance. Okay. You're not going to tell me I'm going to take away a food group. See, when we used to live, we didn't have as big of a cortex as we have now, and the cortex is what needs more glucose than any other organ in the body. Okay. So, what's that? Yes. Okay. So I'm going to say to you that Paleo man had less cortex than we did. Okay.
And they still will if they
That's right. So I'm just, you know, you have to take everything. For me, again, and I know I'm not going to be able to prove everything I'm saying as far as studies, okay? But I'm coming to you from 25 years of clinical experience with my patients, plus the biochemistry behind what I'm saying, plus watching to see when people are doing those other things and what it does to them, because I'm looking, okay? I can't tell you how many people don't realize that when they go low carb, their cortisol goes up, okay? That's what happens every time. Cortisol goes up, okay? It has to, otherwise you're going to die. That's the mechanism. So what happens is if you then do salivary testing early on in these patients, you're going to see very high cortisol. But if you don't do it early on, what are you going to look at? You're going to see very normal looking cortisol because it's actually starting to burn out. Okay? Then you think everything's fine because you got this number that looks good. Okay? But if you keep doing that, what's the next step? Now you're going to have very low cortisol levels. Everybody knows what that means, right? But you have to know that, hey, if somebody's on a low carb diet, this is back to biochemistry being immutable, that will always cause cortisol to go up. Always. And if you don't see high cortisol in somebody, you got to start worrying about their adrenal glands. Is that making sense? Yeah.
That's when you get into adrenal exhaustion.
Yes. Because what then starts happening is your nervous system still makes noradrenaline, which is inflammatory, but your adrenals can't make cortisol, which is anti-inflammatory. And now you're into, I'm wired and I still have energy, but I'm inflamed. That's adrenal burnout. It's only half of that. Exactly. Okay. That's why you see all those diseases when adrenal burnout that are inflammatory in nature. Is that kind of making sense? All right. So, how much longer do I have?
2 minutes.
Oh, geez. And that's the end of my lecture. No.
We can go till 5 too, but they.
Okay. Oh, I see. They start to.
Yeah.
Oh my God.
So,
I'm so surprised the hook hasn't come off to take me off the stage. Okay. So, I think also what we're not really aware of or we don't think about, and I think this is the last thing I'm going to talk to you about, is the fact that my body will compensate as long as both sides of my metabolism are still functioning. Okay? But the moment I have compromise in that system, that's when I'm going to have disease. Okay? So you start off with insulin sensitivity. Everybody does, unless you have an inborn error of metabolism, which very few people do. Okay? So we're going to just talk about normal. Okay? And insulin sensitivity can become insulin resistant. That's acquired. That's not a genetic issue. Okay? I can cause my body to be in insulin resistance because there's two types of insulin resistance. One is primary, where I have damage inside the cell. Okay? And the other is secondary, when adrenaline and cortisol and noradrenaline are blocking the action of insulin. Remember what I said early on? You can't be in both sides of your metabolism at the same time? Okay? So I can have insulin, and it's functioning just fine. But I have more adrenaline, cortisol, and noradrenaline. Who's going to win? Okay? I'm going to be in my using side, which means I'm not building, which means I'm insulin resistant. Okay? We see more insulin resistance from noradrenaline than we do from anything else. Okay? So if you're looking at some of the literature on diabetes, they're now saying, wow, noradrenaline levels are very high in diabetic patients. Okay? Which makes sense. Okay? So, and you see it all the time, right? Take a type 1 diabetic. Right? They eat the same, They take the same insulin for what they're normally eating, and then a big stress happens. What happens to their blood sugar? It spikes, right? I guess nobody in here has ever treated a type 1 diabetic, but that's what happens, okay? Which is very frustrating to people with type 1 diabetes because they're being taught that the only thing they have to do is eat well and take their insulin and everything's going to be fine, because we're not teaching them about the other side of the metabolism and how stress plays a role. Or they'll go out and over-exercise and raise their adrenaline really high and come back with high blood sugars, and then everybody's so surprised that this person who exercised has high blood sugars. Well, of course, the adrenaline and the cortisol and the noradrenaline is driving that chemistry, right? So you have to start paying attention to just the physiology of the body. So anytime, with anybody. Now, the problem, this is the big problem, and this is where everybody comes in with, well, what if I do this, and this is the way to do it, and all that kind of stuff, is you don't see damage while it's being done, okay? Unless you're really digging deep looking for it, okay? So the most important way to do it is you start to do that, and you start to measure cortisol levels in people, because we can't measure adrenaline, okay? And if you're doing something that's raising your cortisol too high, and it's staying up that way all day long, you're doing the wrong thing. Okay, because that's not normal physiology. You're not supposed to go, oh, I'm going to spike my cortisol and leave it there, and then I'm going to turn around and spike my insulin to compensate for that. That's too much, right? You need to live here. You need to live here. I do want my using hormones to go up. I want my building hormones to go up. I want my using hormones. I don't want this, okay? I can do this for a while, but what do you think that leads to? Disease. Okay, so that's what I'm talking about when I'm saying, be very careful what you think you're doing, okay? And again, the younger you are, you're not going to feel it, okay? Take somebody, I love all these people who come to me and say, oh my God, I used to be on this type of diet, I felt great, now I do it and I feel terrible, okay? So they, again, you're starting to feel the effect of doing it incorrectly when you're older because things aren't working as well, okay? So, insulin sensitive, the building side is present and it's functioning. And all you have to do is eat well and you'll activate it. Insulin resistance, you can eat well all you want. You're not going to activate it. Okay? That's the problem. So that's why you can't take someone who is damaged and go, oh yeah, if you just eat well, you'll be fine. No, they're eating well and they're not fine because they're not building well from what they're eating. Okay? And until their body starts to slowly take in that food and start to process it and start to turn it back into the chemicals that make that pathway, they're never going to be fine. And that's why it takes years to heal insulin resistance, not months, not a year, okay? But at least about 7 years is what I've seen, okay?
Okay, I'm going to take while you're taking your breath, great information. Okay, but in fact, let's give Dr. Schwarzbein a hand.
Thank you.
Okay.
I'm going to get some water while you're doing that.
But as in everything, now she can answer questions for till we have to walk out of here, be out of here at 10, but we're going to have to go off camera right now. So for those who are seeing this on YouTube, various methods, we are so happy that you joined us, and we're going to be taking the rest of it off camera until 2 to 10 when they're going to literally kick us out of here. So anyway, thank you everyone.
Thank you
for attending, but everything else will be off camera. And bye for tonight.